Assalamualaikum warahmatullahi ta'ala wabarakatuh, and good afternoon to my beloved lecturer, Sir Ahmad Zulkarnain. My name is Siti Nur Aina Nazira binti Abdul Halim, and I am from SR2454A. I would like to begin the presentation with the special test on spine. This test has 6 special tests, which are SLUMP test, spurring test, cervical distraction test, KEMPS test, FABER test, and femoral nerve tension test. All these tests is to treat pain related to spine.
Anatomy of the SLUMP test. SLUMP test is a neurotension test used to detect altered neurodynamics or neural tissue sensitivity. The patient may experience stretching, pain, or other neurological sensation in the area of adhesion. Another use for the test is detecting lumbar disc herniation with the flexed lumbar spine and hips complete simultaneously with the extended LE. The sciatic nerve and its respective nerve roots are put on tension to detect the potential of a disc herniation. The common injury for the SLUMP test is lumbar radiculopathy. Lumbar radiculopathy may occur when the spinal nerve roots are irritated or compressed by one of many conditions, including lumbar disc herniation, spinal stenosis, osteophyte formation, and other degenerative disorder. Mechanism of injury for the SLUMP test. The dural sheath around the sciatic nerve is being stressed or stretched as the patient changes position. The patient may experience stretching, pain, or other neurological sensation in the area of adhesion. Another use for the test is detecting lumbar disc herniation with the flexed lumbar spine and hip complete simultaneously with the extended LE. The sciatic nerve and its respective nerve roots are put on tension to detect the potential of a disc herniation. The procedure of the SLUMP test. First of all, ask the patient to fold the hands behind the back. Next, gently apply overpressure the shoulder with one arm and bring the chin to the chest. Last but not least, ask the patient to extend the knee on the affected sides while maintaining the position. The do and don't for the SLUMP test. The do, first of all, must in the correct position and must sit properly. The don't, patient cannot lay down on the floor while the test begins, and patient cannot move while the test begins. This is the procedure of SLUMP test. First of all, ask the patient to fold the hands behind the back. Next, gently apply overpressure the shoulder with one arm and bring the chin to the chest. Last, ask the patient to extend the knee on the affected sides while maintaining the position. Anatomy of Sperling test. Sperling test used during a musculoskeletal assessment of the cervical spine when looking for cervical nerve root compression causing cervical radiculopathy. Common injury for Sperling test is cervical radiculopathy. Cervical radiculopathy, commonly called a pinched nerve, occurs when a nerve in the neck is compressed or irritated where it branches away from the spinal cord. There are 6 mechanisms of injury for the Sperling test, which is number 1, compressive flexion, number 2, vertical compression, number 3, distractive flexion, number 4, compressive extension, number 5, distractive extension, number 6, lateral flexion. The procedure for the Sperling test. Number 1, Patient sit on a chair with the body straight, lock the back and face forward. Next, turn the patient head on the affected side while extending. Last but not least, apply a downward pressure on top of the patient head. The do and don't for the spelling test. Do the body in straight position and lock the lumbar. The don't, patient can move and speak while the test begins. This is the procedure of spelling test. First of all, patient sit on a chair with the body straight, lock the back and face forward. Next, turn the patient head on the affected sides while extending. Last but not least, apply a downward pressure on top of the patient head.
The anatomy of the cervical distraction test. This test also called traction distraction. It is designed to detect the presence of a radicular pain in the symptomatic limb caused by cervical nerve root compression. It can be used for localized mechanical neck pain is suspected. If the distraction aggravates the localized pain, involvement of neck musculature or the capsules of the cervical facet joints should be considered. So for the procedure, the first step is patient lies supine and the neck is comfortably positioned. Then examiner securely grabs the patient either by placing each hand around the patient's mastoid processes while standing at their head, or place one hand on their forehead and the other one on the occiput. Lastly, slightly flex the patient's neck and pull the head towards your torso, applying a distraction force. For the common injury that needs cervical distraction test is cervical radiculopathy with a neck and arm pain. The mechanism of injury: nerve in the neck is compressed or irritated where it branches away from the spinal cord. Pain that radiates into the shoulder and or an arm, and muscle weakness and numbness. The do and don't during the test. The do is do lying in comfortable position and neck in relax, placing the hand in correct step and position on the patient's neck. While the don't is not relaxing the muscles on the neck, improper placing of hand by the examiner, and also improper position of the examiner. Patient lying in supine position and relaxed for the test to be performed. Place each hand around the patient's mastoid processes while standing at their head. Apply a distraction load by gradually tractioning upwards, taking the weight of the head off of the neck and shoulders.
Assalamualaikum and good evening everyone. My name is Engku Faiz Nakiuddin, and for this video I'm going to present about KEMPS test. The common injury for this test is facet joint syndrome. On to the next slide, we have the mechanism of the injuries, which is also the other words for the causes of the injury. The first one, we have repetitive stress to the spine because of excessive weights or movement. The other one is aging or trauma may also cause the joints to wear down, allowing the bones to rub against each other. Okay, so for the procedure, we have three procedures here. The first one is the patient needs to be in a standing position, extending the spine maximally. Okay, so for the step number 2, the patient should rotate and lateral flex to the side of the pain. And for the last step is you just have to repeat the process all over again, but on the other side. Okay, on to the next slide, we have the do's and the don'ts for this test. For the do's, the patient needs to be in either standing or sitting position for this test. And the second one is the patient needs to let loose and not tense their muscles to provide accurate results for the examiner. Okay, moving on to the don'ts, which are the things the examiner is not supposed to do include the examiner do not perform the test when the patient is in a supine or prone position. The examiner needs to assist in relaxing the patients if the patient is in a tense state. Lastly, the examiner must not continue the test when the patient is hurting. Hello, it's me again. I'm going to present about the FABER test. The common injury here is the sacroiliac joint sprain. Okay, next we have the mechanism of the injuries. For the first one, sudden compressive loading and rapid rotation. The second one is a direct trauma to the pelvis due to a fall or collision on the playing field. And sometimes there is no clear cause for this condition, which is kinda scary to think about. On to the next slide, we have the procedures. And as always, we simplify into 3 procedures. For the step number 1, we have the patient needs to be lying in a supine position, meaning that in a supine position, the patient needs to lay on their back facing up. Okay, so for the step number 2, when we're done having the patient lying on the supine position, we're going to flex and abduct the patient's hip by placing their leg into figure 4 position. For the last step, we as the examiner are going to place our hand to stabilize the pelvis and place another hand on the patient's flexed knee and apply pressure for as much as the patient can handle. I mean, we're not in this test, we're not going to bring and cause any harm to the patient, so we need to be super careful when performing this test. Moving on to the next slide, we have the do's and the don'ts for this test. For the do's, the first one is the patient needs to be in a supine position, and then we need to ensure the test is not causing harm to the patient, and we as the examiner needs to have the knowledge on the field, meaning that we need to have the knowledge about the procedures and all the general knowledge regarding this specific test and the common injury. And lastly, the patient needs to be in a calm and relaxed state. So when the patient is not in a calm and relaxed state, the muscles of the patient are going to be tensed, which is going to be more difficult for the examiners to examine the patient. Okay, moving on to the don'ts, which are the things we're not supposed to do when performing the test. So for the first one, we do not perform the test when the patient is in a prone position. Prone position meaning that the face of the patient is facing downward, meaning that they are laying on the front face of the body while the face is facing downward. Yeah. Okay, next we need to avoid getting rough when performing the test to avoid from causing any pain to the patient. And lastly, we do not proceed the test when the patient is hurting. These are the steps on how to perform a FABER test. Ensure the patient in a supine position. Bring one leg to form a 4-figure position like this, and then place one hand on the pelvis and place the other hand on the flexed knee to apply pressure.
Hi, Assalamualaikum. My name is Muhammad Sharafi Sharudin. My metric number is 2020871772. And I would like to continue with the last part, which is femoral nerve tension test. Okay, so the anatomy of femoral nerve tension test. First one is it also known as femoral nerve stretch test, FNST. Femoral nerve. Uh, the femoral nerve lies within the femoral triangle, which is founded by the inguinal ligament superiorly, the medial border of sunctorius muscle, and the lateral border of the adductor longus muscles. Next is the common injury. Okay, so the common injury is the first one is direct injury, which is trauma. Second is prolonged pressure on the nerve. Third, compression, stretching, or entrapment of the nerve by nearby parts of the body, or disease-related structure such as tumor or abnormal blood vessel. Next is the mechanism of injuries. The mechanism of injuries, which is one of it is a broken pelvis bone. Second one is a catheter placed into the femoral artery in the groin. Third is diabetes or other causes of peripheral neuropathy. Fourth is internal bleeding in the pelvis or belly area, which is at the abdomen. Fifth is lying on the back with the thighs and legs flexed and turned during surgery or diagnostic procedure. Okay, next is the procedure. So the procedure is the first one to conduct the test. The patient must be in prone lying position, and then we need to flex their knee to 90 degrees, and we add uh, passive hip extension as far as possible. Lastly is uh, we need to hold the position for at least 45 to 60 seconds while looking for any reproduction of symptom. Alright, so this is the do and don't during the test. Okay, first one is to make sure the patient is in right position, which is in prone lying position with comfortable. Next is examiner need to flex the patient's knee with proper technique, or in other words, the examiner needs to use right technique to do the test. Okay, and then we move to the opposite side, which is the don't during the test. Is examiner use wrong technique to do the special test, which could be harm or could be further the injuries of the patient. Next is patient is not ready or not in a relaxed position to do the test, that might be disrupted the process of doing the special test.
Okay, so in this video, I would like to demonstrate how to do a femoral nerve test. The first one, patient must be in lying prone position. Second, bend the patient knee to 90 degrees, and then add hip extension as far as possible. Put your palm at the lower back and hold this position for 45 to 60 seconds and look for any reproduction of symptom of the patient. Okay, that's all.